Join me and the entire member schools of the Michigan High School Athletic Association in supporting the University of Michigan Concussion Center. These are the experts that are working hard every single day to keep our kids as safe as they can be. I've been with the Michigan High School Athletic Association for the last 17 years. My first 13 years, I was one of the assistant directors in charge of officiating a handful of sports and really became kind of our point person for all things sports medicine. For the last 4 years, I've been the executive director, and with that, health and safety is a daily priority, and our work in the world of concussion has really maintained, it's been at the top of the list. It's been hard to keep it there with COVID, but certainly head health and all of our concussion efforts have been front and center. So it's been a wonderful 17 years, and the last 4 as the director. All of our concussion efforts have really been front and center for the MHSAA over the last decade. There's really 3 areas or 3 lanes, so to speak, that we've spent most of our time. The first lane, and if anybody's a swim person, you know it's probably the widest lane of the 3, it's been education. As we've really tried to address concussion, the first volley has been education. It's been what are the signs and symptoms? When a suspected concussion has happened, then what are the next steps in terms of getting in front of that medical provider and follow-up care, and how can we get that athlete to return safely to play? So education, it's with our coaches in their preseason meetings. It's every time we meet with athletic directors. It's just been a very common theme. So education has been our biggest push. The second thing that the MHSAA does is we form rules and regulations. You look at how our contact sports are played now versus 10 and 15 and 20 years ago. You see that we've really done a good job with all levels of football of getting the head out of many of the contacts that you see during a game. 10 years ago, you never heard of targeting, and that's been a new rule that has fundamentally changed the way the game is played. It's a way that we felt we've been able to keep the integrity of tackle football or ice hockey or soccer, but yet make it as safe as possible because of some of those changes and tweaks that we've had with playing rules. So it's been education, it's been rules and regulations, and then last but not least, it's really been, I think, removing the stigma. When a student would suffer a concussion over a decade ago, it was, well, you got your bell rung, or you just got your eggs scrambled a little bit on that. And just, why don't you take 5 minutes and kind of get yourself back together and out back onto the field or the court or the ice, the athlete went. I think we've really changed the narrative to say that when a possible head injury has happened, we need to stop and we need to get that young person evaluated. So there's been an awful lot of work with sideline or courtside detection, and then what are the next steps? How long before that student athlete can come back to play? What kind of intervention and information should mom and dad have when that student athlete gets home? When should they go to that medical provider? So really those have been the 3 lanes that we've done most of our work in. It's been education, it's been rules and regulations, and then it's really been trying to eliminate that stigma of a head injury. Really is no different. It's you have an ankle injury, a knee injury. There's a certain pathway to allow that student to return safely, and we've really tried to use that same approach when it comes to possible head injuries. Organizations talk all the time about putting health and safety front and center, and I think sometimes that's easy for some in leadership positions to say is kind of almost a throwaway line. And the thing that the MHSAA has done is we've really put our money where our mouth is. For all of our member schools, we provide concussion care insurance. Now the concussion care insurance, it's gap insurance. So a student athlete who has a head injury, possible head injury, and let's say their family has insurance, from $1 all the way up to $25,000, that concussion care insurance will cover anything that is left unpaid by a family's primary insurance. We've even had situations where a student and a family have no health insurance. And with that being the case, then our coverage kicks in, and again would have coverage all the way from $1, there's 0 deductible here, all the way up to $25,000. So with everything that we've done in terms of education, everything we've done with identifying the signs and symptoms, when it really comes to some significant action, us providing that insurance coverage free of charge to our member schools has been a game changer, because we want to eliminate any possible financial barrier or hurdle for a young person to go in and get the evaluation that they need. The partnership that we have with the University of Michigan Concussion Center, it's one of the most valuable relationships that we have. When really concussion became a major focus, and really this came out of the NFL. The NFL for years had major issues with the research, I think with their education, and a lot of it became the spin factor of possible head injuries with those that had played professional football. All of us that operated in the amateur athletic space knew that we needed to do something to address the problem, and that had to start with education. It had to start with updating rules and regulations, and also giving folks the tools they needed to get the important care that they had to have. I think a lot of us in amateur athletics initially set out kind of our own course. We were going to do our own thing, and what we learned very, very quickly is, with us being athletic administrators, we're not medical experts. And so working inside of our own silo when it came to concussion wasn't going to be as effective as it needed to be. And thankfully, very early on, we got connected here with the University of Michigan and their concussion center team. It's resulted in a partnership to where we use the University of Michigan to now provide the education that all of our coaches have to see each and every year prior to the season. It's really been the hub of the wheel as we've talked to parents, and we've talked to student athletes, and we've talked to school board members and school administrators about how important concussion education and concussion recognition is important. So, I think a real lesson in leadership is sometimes you have to know what your limitations are, and we know what we're good at, and that's communicating, that's building up the systems to communicate with 750 member high schools in our state. We needed to find experts in the field of concussion, and that's why the relationship with the University of Michigan's Concussion Center has literally been a home run for us. When it comes to concussion, I think the High School Athletic Association, we've come to a little bit of a crossroads. When concussion, and really when concussion legislation was moving quickly in every state in the country, we set forth, first of all, on an education plan, and that's been very successful with the partnership with the University of Michigan's Concussion Center. The second big part of that was the notification and the tracking. Right now in Michigan, every single concussion in a high school athletic activity gets reported to our office through an online reporting system. So it's about education, it's about tracking, it's about data, it's about statistics. And I really think now we've got to kind of figure out what the next steps are. A lot of the policies and procedures are the originals. That when a student has a possible head injury, has now been diagnosed with a concussion, well, right now the only people that can clear that student to return is an MD, a DO, a PA, or an RN. Our challenge is, where does the athletic trainer fit in that model? Athletic trainers in the state of Michigan are now licensed, and many of our schools have a competent, licensed, and certified athletic trainer that services them in their schools, and we're trying to figure out what role does the athletic trainer play in that return to play continuum. So I think it's now we're kind of ready for concussion rules 2.0, that we figured out a way of how to communicate, we figured out how to collect all the information and data, and I think with anything, you either evolve or you get stagnant, and here over the next 12 to 18 months, the next steps will really be to modernize some of those regulations. I think the ways that, as an organization, our knowledge of concussion has really changed over time is there is now more research today in head injuries at all levels of sport than what ever existed before. I think where we're so much different than we were almost a decade ago is we're truly making data-driven decisions. I think some of those old mindsets of, oh, you've got a concussion and it means a week to 10 days in a dark room with very little interaction with anybody, and that's the best way to bring somebody back to full activity. And what we found is the data suggests that is just not the case. That the smartest way in most concussions is that idea of active recovery. That we need to give the student and their brain a chance to rest and recover, but yet we've also got to be very smart about that active recovery, because in many cases that can bring somebody back not only healthier, but we can actually bring them back and get them moving again athletically, and even most important, back in the classroom academically, if we really follow a good balance of active recovery. So I think that's been the biggest perception that's changed. A never-ending battle is continuing to educate parents. A lot of parents, fortunately or unfortunately, as they parent their own athletes, they a lot of times revert to how it was when they were a high school athlete 20 and 25 years ago. And again, those were the old days of got your bell rung, got your eggs scrambled, just toughen it up, suck it up a little bit. And those are mindsets that we continue to change. So we've made a lot of progress over almost the last decade. Our challenges for every group of parents that we educate, we have a group of parents that graduate every year, and we get a new set of athletic parents that come into our system. So educating parents especially is really going to be a never-ending cycle until hopefully some of the student athletes that we're reaching today, when they become athletic parents themselves here over the next 10 to 15 years. When we look at potential partners of folks that we're going to work with in any realm of our operation, whether it's education, whether it's how do we improve our programs, who are some of those on the leading edge of what's going on out there in the field, we really want to be partnered with the leaders and the best. And I guess to use that line here of the University of Michigan, the university was world-renowned in terms of the work and research they were doing in the area of concussion. So given the fact that our offices are only an hour away in our state capital in Lansing, it made perfect sense that when you're less than an hour away from a group that are experts in the country, it just made sense to build that partnership. So we most aggressively jumped into education right away, and so much of that content comes directly from the Concussion Center here at the University of Michigan. So it was, I think a lot of times experts in life have to be 4, 5, 6 hours away, and I think that you've often got to be smart enough to realize that there are experts a lot of times in your backyard, in your area, and you just see what the University of Michigan is doing in this area across the country and across the world. It was a really easy decision to partner representing all of our 200,000 high school athletes in our state. The thing that excites us about being a champion, a partner with the University of Michigan, is that we're helping kids. I think our mission each and every year is how can we give a tremendous experience to the 200,000 young people that participate in school sports in Michigan every single year. And if we can get the most cutting-edge, current, up-to-date concussion information in front of our kids and parents, that's only going to allow that experience to be done as safely as it possibly can. You know, we often talk about our contact sports that there's never been a safer time to play. There has never been a safer time, in my opinion, to play high school football or high school ice hockey or high school soccer. Because first of all, in those contact sports, the equipment never been better. We've had playing rule changes over the last decade that have all really been cognizant of how do we keep concussion and possible head injuries to an absolute minimum. We've changed the way that the games are officiated. We've gotten better information in front of parents where they now know the signs and symptoms of a possible concussion and head injury. So really, when you combine all of those factors together, the reason that we're excited to be a champion partner with the University of Michigan is at the end of the day, we're keeping our kids as safe as they can be. And I think whenever you do that, you can sleep quite soundly at night. I think the work that the Concussion Center is doing, especially when it comes to those underserved communities in our state, is really amazing work. With the MHSAA concussion care insurance, we've tried to remove some of the financial barriers to kids and families getting the help that they need. A state as diverse as Michigan, where you've got one of the largest urban cities in the entire country, and then you also go into the Thumb and the Upper Peninsula and northern Lower Michigan, and you have incredibly rural areas where you can go dozens of miles, if not hundreds of miles, before finding a healthcare professional. So, and then of course you've got every other iteration in between that. So the work that really through the partnership, that with us removing the financial hurdles, the Concussion Center, of really making the focus of getting access to the proper medical attention that students need, and right now that's being done in the city of Detroit with the Detroit Public Schools. That just shows how two organizations working together, hand in hand, can really make a difference for young people, and it's making a difference with their health and safety, which I'm not sure there's anything more important or significant than that. I think one thing that our concussion education efforts have done is it's really changed the mindset that old school mentality of, well, just shake it off or you're going to be okay, is something that we cannot go backwards with. I think we've really broken down a lot of stigmas when it comes to kids in medical care. I think a topic is mental health has been one where we're constantly breaking down barriers. I think this very macho, tough mentality that kids have had about possible head injuries is really something of the past, that given the awareness that coaches, that officials, that parents now have, at the end of the day, I think we realize that somebody's head health is much more important than a single game, a single win, a single loss, that there's a bigger game here. 1% of our kids are going to go on and be able to play one day where they're going to make a living as an athlete. And I think for the other 99 plus percent, that is a mantra that our kids continue to need to hear, to take a look at the bigger picture, do what's best for yourself. Your health is the most important thing, and I think that mentality, especially with our coaches, has been something to where kids, when they see something or feel something, they need to say something, and that's really been effective messaging for us. In sports, having the right teammates is often the difference between winning and losing. I can tell you that the Michigan High School Athletic Association is proud and could not have a better partner than the University of Michigan Concussion Center. To keep our kids as safe as they can be, it's important to make sure that you're getting the right information in front of people with the right teammates. So the MHSAA and the University of Michigan are great teammates as we continue to keep kids as safe as possible.